All right, it is time now to know what's on the front pages of Nigerian newspapers. CEO CKN News, Kehinde Nwandu is here, as well as Chartered Accountant and Public Affairs Analyst Sesan Okunade, whose birthday is coincidentally today. Good morning, happy birthday to you.
Good morning, good morning.
Congratulations.
Thank God for life.
Thank God for life,
Yeah,
more life and prosperity.
Amen, amen.
All right, let's head straight to the papers now, and I begin with the News Direct. Infrastructure decay. TED Fund releases 1.6 trillion naira to 220 tertiary institutions. TED Fund releases 1.6 trillion naira to 220 tertiary institutions. You find details of the story on the pages of the News Direct. To the national economy now, economists tackle DMO on $88 billion debt, says Nigeria's debt unsustainable. Economists tackle, that's the Debt Management Office, on $88 billion debt, says Nigeria's debt unsustainable. To the Daily Trust now, motorists groan over hiking registration, license fees. Lagos confirms increment, condemnation in Rivers. Drivers reject increase in Kaduna Taraba. Can we yet to implement? We are not responsible, FRSC. All right, and you find pictures of flooding there as well. All right, to the front page of the Business Day, impressive half-year results shows cinema rebound. Impressive half-year results shows cinema rebound. To the front page of the Nigerian Tribune, PDP goes to court once Buni sacked as Yobe governor, accuses him of holding two offices at the same time, says PDP governorship candidate in last election should be sworn in. Details on the pages of the Nigerian Tribune. To the Daily Sun, PDP asks court to sack APC chair Buni, deputy. One's own candidate declared Yobe governor will meet in court. Governor speaks there. All right. We move now to the front page of the Blueprint. Abdusalami at IBB dialogue. Why separation will be difficult. Why separation will be difficult. You find details of that story on the front page of the Blueprint. To the Daily Times now, doctors strike. Federal government insists on no work, no pay policy. Federal government insists on no work, no pay policy, denies threatening to sack resident doctors, rules out possibility of fresh lockdown despite surge in COVID-19 cases. You find details of all of the stories on the pages of the Daily Times. To the Nation newspaper now, striking doctors slammed with no work, no pay rule. Resident doctors summoned by industrial court. We won't surrender. Strike not best option to seek action. Governors Forum cautions medics. You find details of the story on the pages of the Nation newspaper. To the First News newspaper now, COVID-19 Nigeria High Commission in London short. COVID-19 Nigeria High Commission in London short. You find details of the story on the pages of the First News newspaper. To the Leadership newspaper now, COVID-19 third wave amid surge in Delta variant cases. Federal government rules out lockdown. And then we move to the Guardian newspaper. COVID-19, 3 states at risk as federal government suggests precision lockdown. All right, you find the details of all of the stories on the pages of the Guardian newspaper. To the Punch newspaper now, COVID-19 free rise. States defend community testing stoppage. Experts warn of disaster. No mass testing. If someone feels somehow, we test. Ekiti Task Force coordinator speaking there. Well, decision to stop community testing dangerous, wrong, short-sighted, says Tomori. All right, you find details of all of the story on the pages of the Punch newspaper. And finally, on the front page of the Vanguard newspaper, COVID-19, experts blame federal government as cholera rages. A lockdown is last-minute measure, says Health Minister. Our problem is not another lockdown, but getting people to adhere to safety guidelines. Nigerians have thrown caution to the winds, NARD, well, as federal government spends 122 billion naira to procure G&G vaccine. All right, that's the stories on the pages of the papers this morning. But we'll look at the Nation newspaper, the headline on the front page of the Nation newspaper, talking about striking doctors being slammed with no work, no pay rule. And again, the resident doctors have been summoned by the industrial court. The federal government is said to have taken the striking doctors to the industrial court, so to speak. But then again, CKN, talk to me about what you think of the government's handling of this matter, seeing that we have a rising case of cholera and we have COVID-19, and the minister is saying that the doctors have to return to work, they will not be paid. And then we see the health minister for health saying that these people should understand that it is taxpayers' money, and so they owe a duty to the taxpayers to care for them, especially at a time such as this. And so no work, no pay will be implemented.
It's quite unfortunate the way we do things in Nigeria. Two wrongs cannot make a right.
All right.
If the doctors are going on strike and you think the best way to go about it is by saying no work, no pay, well, all well and good. But you're also saying the taxpayer is taxpayers' money. If the taxpayers are not healthy and they are sick, they will not be productive enough to pay tax. If you understand what I mean.
Yeah.
So it's neither here nor there. If you reach an agreement with an association, it is within you to make sure that you adhere to the terms of that agreement. And that was why you signed that agreement. And this is not the first time. We have seen that with ASU. We have seen that with ASUP. We've seen that with the judiciary, remember the judiciary union that went on strike for several months. And that seems to be the only language that the government understands. Except an association decide to go on strike, they will not listen to them. Before this strike, I know that the NARD gave some kind of notice to the government that if within this period you are not going
117 days.
117 days, that is almost 4 months, and nothing was done. And they couldn't reach an agreement with them.
But the minister said that he didn't get the 15-day notice that they were supposed to get before the strike.
Why do he need the 15-day notice when he has already been given over 100 days? And it's rather unfortunate that even the person making this statement is a medical doctor. And that is the irony of it. Chris Ngige is a medical doctor. The Minister of State for Health is a medical doctor. The Minister of Health is a medical doctor. So these are members of the same fraternity. They are not part of our own fraternity. It is within them. And they know the oath of allegiance they took when they were graduating from medical school. So, and come to look at it, how many doctors do we have in Nigeria? If you look at the World Health Organization indices on health, we're nowhere.
The ratio.
We are nowhere around that. And you're also talking about the rising cases of COVID. Cholera is killing people on a daily basis. Almost close to 1,000 people have been killed now. And most of these people dying are the poor people. They are the poor. Especially the cholera. Rich men hardly get cholera. It's only those in the villages and the rest of them that from water and the rest of them. And where will they go to? They don't have money to go to private clinics. They will only go to government hospital. The same government hospital that is now under lock and key. So it's rather unfortunate. I still believe that the government should do the rightful thing. If you reach an agreement with them, if you know you cannot be able to meet certain agreement, don't sign it. Once you sign an agreement, it becomes a contract. It becomes binding on you as an individual or as an entity. And that shouldn't be the way to go. Look at on a daily basis, our doctors are not living.
Yes.
You see the mass movement of doctors, not only doctors, even nurses. We tell now, maybe journalists, maybe we join them.
The bankers are in the
your profession is also, you see what I mean? So that is the situation. So things are so terrible that Nigerians are not even they are finding it difficult to feed. If you don't pay a doctor, how will he feed his family? What some of them say, some of them participate, go into private practices and the rest of them. Is that the question? They have a job to do and they must do it. So absolutely. You just have to pay them to be able to. Some of them have not been paid their COVID allowance. You know, since last year, they have not been paid. What are we talking about? And some of them also died of COVID.
Yes,
why
I remember.
People? You remember vividly? Yes. Well, so what are we talking about? It's quite unfortunate.
Sesan, before we come to you, we need to quickly take a commercial break. When we return, we'll continue reviewing the newspaper headlines. Stay with us. Thank you for staying with us. We're still reviewing the papers and we still have our guests in the studio, Kehinde Nwandu, as well as Sesan Okunade. And I was to come to you, Sesan, on your thoughts with regards to this no work, no pay, and the fact that the federal government is summoning, or the industrial court has summoned the striking doctors. But then there are those who are saying that the engagement should be with those states who are owing the doctors and not roping anybody in. I mean, some states are owing these doctors 19 months salary.
First and foremost, let me talk about the issue of ministers, both that of health and labor. The first question I want to pose to them, they are ministers today. If they are on the other side, they are medical doctor. They are not ministers, but they are actually serving the country, and they are this medical doctor. With the Chris Ngige that I'm seeing, he will not take bullshit with the government. He will not take it lightly. Yeah. He will not take it lightly with them. He has to, he will stand his ground the same way he's standing his ground to defend the government, that those people must go back to work. And the question is, why are we treating our medical doctors this way? Do we have the civil servants? Do we have these people that work with the ministers being owed allowances? First and foremost, look at the hazard allowance that they are paying them. 5,000 to risk your life to protect a fellow human being like you. We know the number of doctors that this COVID has attacked, and they cease to be no more. Do you know the trauma you face looking at your colleague in the course of his duty, trying to protect life, die there? Do you know, ordinarily human being, you'll be scared to even carry out the work. But you still stick your neck to do this, and people are owing you. So when you now go to, let's engage the states that are owing them. Every state have justification why they are owing now. And we've asked, can government work on our cost of governance? No civil, nobody amidst the political office holder is being owed. Their SAs, PAs, SSA, SA to the SA, PA to the PA to the PA are not being owed. We have fleets of cars, we have things, they enjoy so much largesse from the same quote that the minister is saying, that taxpayers' money. But you can go ahead to owe the teachers, to owe the doctors. I'm sure you are aware that ASU are gearing up to come off another strike, because they feel that some of these things. And I've seen, I think the federal government had this notion that we are federal government. We do whatever we like. Even when we sign any agreement with anybody, it's not binding on us. Otherwise, if we know what we call agreement, you put your signature as a minister that we are going to do this, and you are coming on air to tell the people that they did not give you 15 days notice that they will go on strike. It's to tell you that there is failure on your part. Why do we need to remind you? Do we remind him when he needs to get his salary?
Well, that's the law, according to him.
If it's the law, they gave you 117 days that we are going to do this. What effort have you been able to make? Have you taken time to engage them on the progress you've made? You see, if you are asking for 5 things, and we have 2 that we can tackle, you can bring them to the round table. At least in April, when they suspended the strike, there was like, okay,
a memorandum of action for 5 items.
You know what there, and they had this gentleman that, okay, let's give them benefit of that let's see what happened. You know, 3 months after, no action, no communication.
There are those who are now, saying, blaming the doctors for calling it off, knowing that government, yes, there was an agreement, but could have waited to see government take action before they called off.
But the same set of people will go back and say these doctors does not have human feeling, and they don't have, and that's why I gave kudos to them, as at the time that they said, okay, let's give government the benefit of doubt.
Right.
That they have done in April. Now, if they are telling you that if you don't meet up some of these responsibilities, the promises you've made, we are not going back, I'm sure they will stand their ground. And the only thing I want to assure, I want to plead to the government to do is, you have this 5 agenda with you. Which one are you tackling as we speak? just give a response. Give them that delivery that you have feeling. As we speak, I feel that the federal government does not have human feeling, and they are not considering. The Minister of Labour has come to tell us that we have more than enough doctors. I don't know where he's carrying his statistics when we have brain drain. Go and look at the lineup of people. I was in a medical, I was in an hospital, and what I saw a doctor doing was reading. And what does that imply? The guy has an exam to fulfill, possibly to cross to the other side.
Right.
So government should look at this area, and for God's sake, if we have our people that are dedicated, that still give that patriotism to be in this country, let them make sure they do what is needful and make them to have that sense of belonging as a citizen and as a professional.
All right. Let's quickly touch on the story because it's of interest to me. That's the story on the front page of the Punch newspaper. COVID-19 free ride, states defend community testing stoppage. Expert warn of disaster. And one of the statements here says, no mass testing. If someone feels somehow, we test. I mean, what is your definition of feeling somehow? Are we not supposed to carry out tests? There are those who are asymptomatic. They don't even show signs.
Yeah.
These are the issues.
I don't know how people feel somehow. I don't know how people feel somehow. That's a language that. How do you feel somehow?
That's maybe you can help me understand.
How will I help you when I don't know, when I have never felt somehow before?
One thing.
But these are the issues.
Is a joke.
Of course.
Is it? You know,
this
is a task force coordinator speaking.
Is a joke taken too far.
Right.
It is a joke taken too far. And I expect the governor of Ekiti State, a well-read, a well-learned, well-exposed, somebody that is versatile, the chairman of the Governors Council, Governors Forum of Nigeria, Governor Fayemi, to call this man and ask him questions. It's obvious that when they were picking those to coordinate this, they didn't even know, they didn't do due diligence. Yeah. For a coordinator of such a huge a group to come up with such, it's very, very annoying. But let us even take it for that. But it's a fact. What we are hearing is the fact the state have stopped testing. That is a fact. That is an incontrovertible. You cannot argue over that. Some of them are even shut down completely. They stated that. But you will see that when they were distributing the 1 billion recently, every state will collect. What they're using that money for is what we don't understand. Right. Because you don't need to wait for me to. What they're supposed to be doing is mass testing of people. Because the data is something that recently we just had some people, high profile people just died. You remember?
About three of them.
About 3 of them. I don't want to start mentioning them.
Yes.
We even had that some people that have even taken the 2 doses died. What does that tell you? That means there is an increment, there is a rise. The only state that seems to be doing something at all is Lagos State. I don't know of any.
But that is one out of 36
plus 1.
Yes.
That is the only one that seems to be doing something. The other ones have gone to sleep. They don't even care. All they are waiting for is another largesse to come from the federal government or from whatever donor agencies and the rest of them to just collect. But that is the problem.
Is not helping us.
That is not helping us in any way. If somebody, a coordinator, should come out and say it is when you start feeling
maybe Sesan knows how someone feels somehow.
Sesan, are you a medical personnel?
The truth of the matter is this man will respond to this and said it was quoted out of context.
Right.
You know, that's the language we hear from them when you see them being criticized on a certain thing that they have done wrong. The federal government, that's why we said day by day, this government continue to build that trust deficit. You shut down the testing at state level, but the federal government is still disbursing billions to state to take care of some of these facilities. Where is it going? Accountability, transparency is nowhere to be found among our politicians. They just take the money, and you expect people to have that confidence that we have leaders that are there to protect their interest. I think the government should just be sincere for once and put into consideration the importance of every citizen.
That they need to specify now that is the state government.
Yes,
because the federal government has played its role. These buzzing funds.
The
At least we know
states,
that.
you see, even we the citizen, it's just we are funny being. Some people even in the state will come and tell you that, no, don't discredit governor. It's just because he's not blowing the whistle. He's doing wonderfully well. Is it because you people go to the TV and he's not talking? But if you are working, everyone will praise and say it. I'm sure Lagos State government has not paid CKN, neither you, to tell you that, go to the year and tell us that we're working. But it's visible. Everybody see the way and manner the commissioner of health, everybody is responding on daily basis to issues. But we are not seeing that from other governor. So I think it's high time, even the House of Assembly should look into it to make, because they are there to represent their people. But every one of them have just kept quiet. The only thing we don't understand is when the largest come, whether there are certain allocation being given to even the House of Assembly that is there to represent the people.
All right,
let them put into consideration.
There are things we don't know, so let's just leave the conversation where it is that we know.
Well,
thank you very much.
Better we don't know.
Until you feel somehow. Until we feel somehow.
I will not feel somehow with regards to this one.
Until they feel somehow.
Until they feel somehow, then they can carry out
anyway, CEO of CKN News, Kehinde Nwandu, thank you so much. Chartered accountant and public affairs analyst, Sesan Okunade. Happy birthday once again. Have a great day.
Thank you, gentlemen. Have a nice weekend.
All right.